People wake up on a normal day and suddenly something happens that changes their lives completely.
Paediatric trauma call, 15 minutes.
A lot of really bad things happen to really good people, but you never think it's going to happen to you.
Stabbed 5 times, including chest, and has got an arterial bleed from his leg.
High-speed RTC moped into a wall.
Jesus Christ, what happened? You all right?
I love my wife.
A&E reception, can I help you? Yeah, 24 hours, 7 days a week. I love that question. What's your opening hours?
St George's, London, one of the busiest and most advanced A&E departments in the world.
Complete baloney amputation of her leg.
I can't breathe.
He looks frail, doesn't he? He looks like somebody who's going to break. I think it's going to be one of those days.
A place where life...
Darling, what's for dinner?
love...
It's still as beautiful as ever.
We have a boy.
and loss
Don't make me cry.
unfold every single day.
And they said there's nothing they can do.
All the patients you're about to see were treated in just one 24-hour period.
You don't know how lucky I am to be talking to you right now.
We see situations where someone's life has just been turned upside down. People always try and remember what the last conversation was, or the last words that that person said to them. And I suppose it's so much nicer if the words that they remember are, "I love you."
No pressure, Suzanne. No.
There's nothing going on here. I'll come and get you when there's actually a patient here. There's no patient here at the moment.
I think when resus is really quiet, it scares me. I'm always on edge. It's that eeriness sometimes. You're just waiting for it all to go wrong.
Ole, 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 ole. Already boom, 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 boom.
Christine has been working in St George's for 10 months and is one of the team in resus today.
Honestly, some days it's too calm. I like when it's busy. I don't want to use the word exciting. I don't mean that. It's not exciting that patients are sick, but I mean it's exciting that a team can work so well. It's just amazing how people just gel and pull together to get a job done. You just cannot tell when is the next emergency.
Okay, get you to open your mouth and say again. I'm just gonna bring that down a bit. Say Okay, there's a clot in that tonsils, so that means it has a risk of bleeding again. Okay, the best thing to do is to stay in. Okay.
Okay.
Right, and we'll treat you for that.
Okay.
I don't think he can go home. All right.
Okay.
It's very, very risky if he goes home.
Okay, no problem. Okay.
63-year-old Zachi recently underwent a tonsillectomy after he was diagnosed with throat cancer 3 months ago. Tonight, he's come to A&E after suffering a bad bleed at home.
Start the bleeding.
It's bleeding. Okay, what can we do?
Coming very fast.
You can feel it coming very fast.
Fine. Okay, no panic. Okay, we'll stop it. All right.
Steve, it's fine, Baba. صرخت. We'll spit it out. Just spit it out as it comes. بهنا سود Erika. It's fine. You're okay. هو هاد دكتورك. هو هاد. He's coming. Here wash.
Not a kid.
Let me just squeeze in a minute, sorry. Can I just pop this on a finger?
Yeah. Do you mind getting me
It's
some
all right.
adrenaline? Some adrenaline.
How much adrenaline?
1 into 10. I want you to lean back. Open your mouth. Keep it there. That's fine. That's fine.
He's just trying to apply pressure, Bob, again. Ma kolbani go nie. To.
I'm going to move you to another part of casualty.
Zachi is being rushed through to resus so doctors can get his bleeding under control. His wife and daughter have travelled with him to St Georges.
I was born in Iraq. My husband was a close friend of my brother. In my culture, we do not have a liberty of forming relationships. So it was a secret love affair between the two of us.
Okay. How are you feeling now, sir?
Very shivering.
Very shivering.
Tired.
Although they say there is no love at first sight, but I did love him at first sight, to be honest.
This is all quite frightening as well, okay? You're in the right place now. Okay? Unfortunately, this does happen after a tonsillectomy. You may have a small infection.
It breaks your heart to see your loved one, the kind-hearted person who has always been there for you. You see him in this situation. It's heartbreaking, really. I don't wish it even for my enemy.
Do you guys want to wait in the waiting room just for a second, just to get him all set on this monitoring?
Okay.
Is that okay?
Will you let us know when we come? Thank you
I'll go and grab you.
You are in good hands, Jerry. Can I not stay here, just me?
I'll give you a chair.
Okay, thank you very much. Thank you.
You can appreciate some calm sometimes. And then something goes wrong, and that's what I mean by you really don't know what time, what is around the corner, what's going to happen. Worlds are just turned upside down in a split second.
Must be a crossroad in here, mustn't it? Ah, here we go. Oh, not Sudoku.
Practice on Sudoku. You need a bit of practice on maths.
What'd you do? No, I don't want to know.
It's easy peasy.
No, I don't want to
Try
know.
the easy one. What a teacher. What easy, really. Right. You got a 1 in that line and a 1 in that. So you need a 1 in that line, but it's got to be in this box.
In this box?
In this box. You can't do it yet because you've got to do a 4 now. Look, that one's got a 4. There's got to be a 4 along here. That can't be 4 because that one is. So that one there's got to be 4. Do you understand that?
No.
Come here. See, oh, let me do it. Give me it then. I'll do it.
St Georges. Trauma medical.
A 10-month-old baby is being rushed to resus after her parents awoke to find she'd stopped breathing.
Paediatric priority call, ETA 8 minutes.
The thought of your baby stopping breathing and not restarting breathing is the worst possible thing that you could think about. And sometimes there's an obvious reason, sometimes a child has anatomical reason for it. Infection is one of the causes, meningitis, bleeds in the brain, seizures even can make you stop breathing. So there's actually quite a long list of things that can make a baby stop breathing. It's quite a scary position to be in for a parent.
This is Amy, 11 months old.
Okay.
Has had a couple of days of being generally unwell. He's put to bed. Mum heard a strange sound, went in and checked her. She was quite pale and quite blue around the lips, and we're querying that she had a convulsion at this point. As Mum said, she kind of went quite stiff and appeared to not be breathing properly. When we arrived, intermittently, she was stopping breathing.
We heard a cry and I was kind of like, okay, do we go, don't we go? And decided to get up. And I just turned back and went to sleep. She's got it, it's all cool. A few minutes later, she came in and she was adamant, we need to call an ambulance. Amy's not well. It's kind of, whoa, okay, what's happening? What do we do? You know, she had her mouth clamped tight. Her eyes were kind of rolling back and she was really struggling for breath. When your baby stops breathing in your arms, I didn't know what to do.
Okay, Robert, you just stay still for a bit. You're a good girl.
I'm just going to see if I can.
I was saying, Amy, no. No. I thought she was slipping away. Instinct to protect the child kicks in the second that she's in your arms. When she's born, you say you're going to look after her, and then she's going through something and you're not.
Quite acidotic, pH 7.09. Basic stress -8, lactate 8. Glucose 9.9.
What colour was her mouth?
Blue lips.
Yeah.
Did she feel stiff?
It felt stiff at what? Yeah, it was stiff then.
Floppy when I had her.
Stiff when I first had her, and he took her, and she just lost her. I'm worried she's not had oxygen to the brain and stuff.
Doctors are concerned Amy's condition could deteriorate and need to work quickly.
Children who can't obviously verbalise what's going on. And the hardest thing is trying to make a decision just from what you see in front of you. As doctors, we can spend a long time looking at babies who have been through something like that, where they have stopped breathing. Even if they're breathing now, we do have to make sure that medically we rule out important causes.
No, you don't need to put your head in there. Why?
3-year-old Bilal is in paediatric emergency with his dad, Amir. While helping his mum hoover the car, Bilal tripped, cutting his ear on the side of the car door.
Where's that going? We're going to be seen soon, I hope. For a 3-year-old, it's extremely patient. I'm not blowing my own trumpet, but that definitely comes from me.
Bilal? My name's Katie, I'm one of the doctors. I'm going to be 2 minutes, but can you pop into that room so I don't lose it? Behave yourselves while you're in there, though. No troublemaking.
I can't say it.
Right, you have to sit here with Daddy now, because the doctor's gonna have a look at your ear. Yes.
And they're going to take off.
No, they're going to have a look at it, OK? Is that all right? Only little look. My father was not really strict, but I've learned a lot from my father in terms of discipline and time management and education.
I'm going to hit them.
You're going to hit them?
Yeah.
No, you're not.
I am.
Can't do that. It's the doctor.
But I done bad.
Excuse me?
I done bad.
No, you haven't. Oh, no. What's that smell? I'm a bit different to him. I mean, I become like a kid as well when I'm with my children. What have you done?
What?
I'm a bit softer than my father was because my father was born in India. So his culture sort of not prevented him, but he was just brought up like that. He was just made like that. Your ear?
Yeah.
It has to be cleaned, son.
No.
Just a little bit.
I don't want a little bit.
OK, right, we'll see what we'll ask her what she can do. Look.
Hello, who's Bilal? Any medical problems that he suffers from?
There's an egg and nut allergy.
Allergies to nuts.
An egg, correct.
Do you have any pets?
Yes.
What do you have?
Cows.
No, we don't have
Cows.
cows. Which animals do you have at home?
Chickens.
That's it.
Do you have chickens? But you can't eat eggs.
But the rest of the family can.
Should we have a look at this ear? Is that OK?
Yeah, just here. Can you leave your shoes on?
Yeah, it's fine, Daddy. I'm going to have a quick word to see whether there's any part that we should maybe glue or whether they might want to do anything with it, but bear with me.
Thank you.
Because that box there has already got a 2 in. That box there has got a 2 in. This box needs to have a 2 in. It's got to be there. Because it can't be them, because there's one on that line, one on that line. Do you understand that?
Wow, we've got new gloves. They're really stretchy. So you've got a little cut on your eyelid. It can probably just be fixed with a little bit of glue. It's going to take a steady hand so I don't glue your eye together. You laugh, but I have actually done that.
I have.
10-month-old Amy stopped breathing in her sleep. She's now conscious, but an X-ray will help determine whether an infection was the cause.
We talked about having children very, very soon in our relationship. It was really important to both of us, especially to Nick. I mean, he was very open to me and said, if I didn't want children, then this wasn't a relationship. And, you know, I tended to agree with him on that because I don't think I could have had a long-term relationship with someone who didn't want children.
OK.
I had so many fears about being a first-time mum. There is pressure to sort of be the first moment you see your baby. Was it utter love? Was it there? Was it then? And I didn't feel that.
Okay, Puppet. Okay, Bobby.
I felt so guilty because I just felt like it was a baby. I didn't have that overwhelming sense of love. I was even scared to tell Nick that I didn't feel like this because I just felt so ashamed. My mum had actually talked to me about this beforehand because this had happened to her as well, so I knew it wasn't anything to be overly worried about because she said, oh, it does, you know, it will kick in. Thank you.
Because most likely, are you allergic to anything, sir?
Penicillin. Penicillin.
He's allergic to penicillin?
Yes.
So we'll need to give you an antibiotic.
63-year-old Zachi was recently diagnosed with throat cancer and came in after suffering with a bad bleed at home. His bleeding has subsided, but his condition remains unstable.
Because there's probably an infection, we need to give you this bleach-like substance to wash the tonsil bed, okay? Take this, and now you're going to start gargling with that. That's it. Good, man. What happens if he has penicillin?
I don't know. I think there was a rash.
Okay.
That was even before we got married.
A
long time ago, yeah.
Well, maybe not that long ago.
It's just 30 years ago.
That's no time at all.
40 years ago. 40 years ago, yeah.
The
last place we were in Iraq was Baghdad. It was a time when we were really very young, both of us, and we moved to the northern part of Iraq. Even there, it was not safe for us, not enough. A number of times when we were bombarded by the Iraqi artillery. There were a lot of casualties around. Hundreds of people would die. My husband, he was very brave, to be honest, very brave. To be told that, don't worry, I'm always there for you, nothing is going to happen to you. As long as there is a breath in my body, as long as there is a heart in my body, you're going to be safe. I felt safe, as though there is an angel who is always guarding me. I had that confidence, I still have it. He has to be in my life. If he has to go, I'm going with him. There was no way that I can stay in a world where he does not exist. And I hope that never happens. I've always prayed to God for me to go before my husband and before my children, because I cannot tolerate the pain of not having them in my life.
You feel anything?
You are an angel. Thank you very much.
Oh, no, I'm too heavy to be an angel.
No, you are an angel. Thank you very much.
I would need very big
Just
wings.
looking at your face gives some peace of mind. Thank you very much.
Taxman's taking all my dough when the moon is seesaw, blazing on a sunny afternoon.
It's okay. Yeah.
Has he got the brakes on?
I don't know.
Just push it.
It's sort
I
of.
think the brakes are on. Just pull it. Pull it.
Yeah, I'll
it's
pull it.
easier.
Where do you want to go?
Just goes right to the end. The brakes are on, love. The brakes are on. Push it with your foot. Push the other one with your foot.
That isn't now. That is on now, you see.
That's it. Just go right to the end. Right to the end. Right to the end. Right to the end, please. Right to the end.
Push around. So you know.
I'm moving because there's a man up there and he stinks to high heaven. And I couldn't... No, it's all right. It's all right. I want to stay in the chair, so... Mind you, that lady's toast.
It's all right, don't worry. I'm on a roll now.
Oh, yeah.
Hello, St Georges. Sorry, you was in a motor by accident. Motocross. So he's fallen 30 feet, you said? Lovely, thank you. Bye. 35 minutes away. What's motocross?
It's,
Never heard that, ever.
Now,
Fallen 30 feet?
I don't know if he's fallen 30 feet, like...
Motocross.
So is that the...
Jumping, doing tricks, all that kind of stuff.
Is it like...
It's like 4x4 motorbikes, you know, when they do all the jumps.
When I heard motocross accident, I was thinking, like, crossroads motorbike. I didn't realise that's what it's called. I've bungeed, I've skydived, and I love whitewater rafting. I am an adrenaline junkie, but going up on a motorbike 30 foot into the air and coming back down, I don't think, no, you'll never catch me doing that.
A 21-year-old motocross rider is being brought in from Surrey.
Motocross accident.
More than 30 feet, yeah, I'd say head to pelvis.
His heavily pregnant girlfriend and family are 1 hour away.
No evidence of external injury on the chest.
Blocks, please. Someone's going to get...
Symmetrical chest expansion.
Just going to put another drip in, okay, and get some blood.
Can we get BP and SATS monitor as well so we can check his pulse?
There's times when you're working in A&E, you have to become mechanical. In resus, it's a matter of minutes. So you don't think for a minute about the patient, where they've come from, have they got kids. You don't know what's going on in the relatives' room. You don't even know if there's relatives out there.
Some bruising to the right flank.
And you really have to switch off, because if you stop and think about it, you will actually dwell on it too much and you won't be able to do your job.
Do you have any pain in your head or in your neck or in your back? Yeah, no pain in your head. You awake?
Everything aches, obviously, from falling that high.
Yeah, and you fell with the bike on you?
I'm suffering. I went over the handlebars.
And the bike landed on top of you. Okay. We would feel a lot more comfortable if we scan you and actually have a look at that neck properly.
After stabilising Craig, doctors are sending him for a full-body CT scan.
Ready? Very slow.
Little drop.
There you go, mate. All right.
Someone falls 30 feet. There's an endless amount of injuries that can happen. Liver lacerations, spleen laceration ruptures, pelvic fracture, long bone fractures, open compound fractures, tib, fib, and never mind the actual head. You could write a book on the amount of injuries that Craig could have had that day.
Yeah, I'm on. Bless.
Hey. You've got a bit of blood there, so she's going to clean it like this. Is that OK? It'll be nice and clean then.
After tripping over, 3-year-old Bilal was brought in with Dad Amir. They are waiting for one of the specialists to assess his cut ear.
Bilal, I've brought my friend with me, Craig, to have a look at your ear too.
Hello.
Bilal's got chickens at home, but he's allergic to eggs.
Oh, that's no good.
Whoa!
Boy, you're heavy, huh? And a little bit of light.
So here's Daddy, don't worry.
It's all right, son.
Do you want to lay down?
Do you want me to hold you? Can we do it while you hold?
You're fine, lovely boy. Who's this?
Good boy.
We're really mean, aren't we?
You're doing very well. OK, son. Just a little bit more. A little more.
All finished.
You're fine, it's done. We're done. We're done.
No more touching.
No more touching now. That's it. Finished.
Done. Look.
All finished.
That's it. Good boy.
Get rid of those tears.
So there's a flap there that's obviously come down.
Yeah.
And I do think it needs a bit of a surgical repair.
Thank you. I think becoming a parent makes you think, oh, my parents did quite a lot for me, you know?
Right.
Even now, my father's always there, whether it's financial support or any other support. He may not have, you know, kicked a football around with me, but he was always there.
He won't be as he is now. You got your phone.
That's my dad. That's why he's got that ringtone. I work with my father as well. He would call me X amount of times in a day, only because he loves us so much, so he can't help it. Right, but he...
It's going to be the same with you.
On Saturday, he didn't call me at all, and I felt the urge to call him then, see if he's all right. Thank you. Thank you very much. Thank you.
I think he'll push me in, that's easier.
It's all right, I'm all right.
Is he a good driver?
He's not a driver.
Oh.
Wait for it, wait for it.
It's best to pull backwards, sir.
That's what I told him.
If you don't mind kindly holding this door, I don't mind doing the driving. Oh, thank you very much, sir.
OK. You're probably more expert than I am.
Well, I'm not so sure about that, but we'll roll with it.
Yeah.
Oh, you're just playing with it now, are you?
You play away.
10-month-old Amy has been kept in paediatrics after she stopped breathing in her dad's arms.
She's back to herself.
She's responding to fluids and antibiotics, but doctors still don't know what caused her to stop breathing.
Oh, you want to play? Go on, you can do anything you want right now.
If she had not have made it, I don't know what would have become of us. I really can't even begin to imagine how that would have affected us, because it just would have left this most enormous gap in my life and in Nick's life forever. F is for fish, 5 fish fingers lying in a dish. Life changed a lot since we had Amy. I mean, it just turns your world upside down when you have a child. I have this child I'm responsible for, and therefore I have to think of her at all times, whereas before I was thinking of me and thinking of Nick. It's a big change from when you're sort of an independent individual to suddenly being a mum. Nice try, darling, whatever.
I'll give you a minute.
You have had quite a bit, so that's good. Well done, Poppet. Now, I mean, the poor child is kissed to death, constantly kissed. I just feel like I need to show her affection and how much I love her all the time, because nothing is more important than making sure she's safe and well.
There you go.
It's not really the same girl. I think we
No.
swapped her.
This is more like you that we know.
We do see babies and children bounce back quickly, and we get results quite quickly, usually.
Cheeky girl.
At medical school, we're not really taught often about the fact that we won't always have the right answer. And I think that's easier to deal with after you've done the job for a long time. There are going to be occasions when we don't know if it could happen again, because at the end of the day, as doctors, we're not all knowing, and we can't always say that it will never happen again. But I can never ever say that everything's going to be all right all the time. I can't do it, unfortunately.
I'd like to try and be black and white, but I suppose when there's no black and white and you know that everyone's done what they could do, you obviously watch her like a hawk. We always did and we always will, so obviously I've hoped that it never happens again.
Thank you so much, thank you.
Doctors are keeping Zachi in resus until they're sure he's stable enough to be transferred to a ward.
Shoin is Daddy's girl, and I have always told her, look, I know you love both of us, but you adore your daddy. She adores him.
Ever since I was little, it was my elder sister with my mum and me literally clinging onto my dad's leg, being with him. I feel like he needs the strength and to know that I'm not worried. I'm okay, I'll hold your hand through this and we'll be fine. We'll go through it together. So used to seeing him strong. I'm used to seeing him smile. Now he's sad. It's not easy. To lose my parents. I've cried myself to sleep about it. It's not something I like to think about. There's nobody like your parents, you know. Very close to mum and dad, yeah. You never appreciate something when it's right in front of you. And I think the more you grow up as well and the older you get, the more you appreciate your parents. last year, my dad got really sick out of the blue. So he ended up in hospital, and he was really ill for a while, and there's a good family history of cancer. So we were worried at the time, of course, that he had cancer. But on the 2nd of October, he got the all clear, and I literally booked my transport and moved here 2 days later to start my job. So I think if it had been bad news, I don't think I'd be here. Sorry, I'm getting choked up. I was always considering maybe possibly going to Canada to work as a nurse, but it makes you appreciate and realise that you do want to be close to home in case anything goes wrong, you know. So, yeah. Life can be so cruel sometimes, you know. For so many people that have had to get bad news, especially on people my age, that's really difficult.
Follow my finger with your eyes, don't move your head. Just let me know if you see double at any point.
One thing I've picked up since I started working in A&E, my accent seems to calm people down a lot. Have you been doing this motocross for long?
Since I was about 10.
Right, okay.
I've never, touched wood, I've never broken a bone in my body.
Really?
I drink so much milk.
That's the key, is it?
Yeah, that's what I've always said.
Just talking to them, just communicating with a patient is enough to keep them at ease. And the bike fell on top of you?
I went over the front of the handlebars, and then as I landed, the bike landed on top of me.
Seriously, you must be drinking litres of milk every day if you...
Yeah, I was more worried about the bike. I spent £6 on it.
Typical, typical.
I shouldn't have gone out 2 weeks before my baby was due. As soon as you get on that bike and you put that helmet on and you get on that start gate, you know something could happen. You've got to be on the ball. You can make one mistake in the air, and like I did, and it's over. I could have been seriously hurt that day.
How's your pain doing?
Bit better.
The noisy child.
Yeah. Got one coming in 4 weeks.
Have you?
Yeah.
Maybe get used to it then.
Yeah, that's what I was about to say. I hope to see the baby.
When me and Tana found out we were having a baby, it was really exciting. At the same time, it was scary as hell, being 21 years old and having a baby. I probably screamed in my pillow for about 20 minutes till it actually sunk in.
So, do you want me to phone anybody?
If you could just phone her and let her know what's going on.
Yeah, do you know her number?
Yeah, unlock my phone.
What's she down as?
It's my sexy girl.
Excellent.
She said it, not me.
She's so supportive of anything I do. She supports me, and the same that I'd support her of anything she does. A lot of people said to me like I'm selfish going out before you had the baby due, but she just said be careful and look after yourself. Like, she can't say anymore. She couldn't keep me on a leash or anything like that. That's all she can say, really. It's all down to me when I'm on the bike.
Oh, that one?
Yeah, that's it.
Fine. Oh, hello, it's Heather, one of the nurses at St Georges. I'm just on Craig's phone. OK, I'm going to try and put you on speakerphone so he can speak to you this end. So hold on. There's hundreds of people there, she said. Right, try that.
Hello. Hello. You all right?
I'm in the car with your mum, your dad and your nan.
Okay.
So we're on our way, okay?
Yeah, all right.
Hello, it's me again. Don't drive safely, don't rush. We'll see you when you get here. OK, bye. I'll just go and tell reception that they'll...
All right, thank you.
And your mum, and your dad, and your nan.
Yeah.
He shouldn't be the one. He's not the right candidate for it. I am the right candidate. I smoked for 30 years. I have it in the family. He doesn't have it in the family. He doesn't smoke. He doesn't drink. He shouldn't be the one. You feel very sorry for people when you hear they have got cancer or there's a cancer case in their family, but it's not like when it happens to you. It's different, really different. It hits you in the core, really.
Zachi is being taken to a ward where he'll remain under observation.
Yeah, but hopefully I think she'll be alright. She's got a neck brace. You not got a picture?
You're yourself so bad.
Huh?
No, he's really interesting. Craig, everyone's here as well.
I've got to go, Will, because everyone's just turned up.
You alright?
So, that morphine's so good.
Could you imagine if I was there? I would have gone into labour.
Motocross rider Craig's girlfriend and family are awaiting the full results of his CT scan.
I'm bored of these tiles now.
Huh?
Could have painted them before I come.
Did you count them yet?
No.
Lots of people count them. Not much else you do when you're lying flat down.
I used to go out every single night with my mates and down the pub and stuff like that. But since Tana's got pregnant, it's made me grow up a hell of a lot. Stops me going out drinking. I haven't been out drinking this year. Probably been out once this year.
On Tanya's Facebook last night, he came up because
He done my
she can't bend
toenails.
down, so he painted her toenails.
Well, they was Tanya's toenails. I thought they was his own.
No, he done
Was that
mine.
later?
That's what I put. I did put, are you going to do your own next?
Motocross, it's just my biggest passion. But having that responsibility of someone else in my life, it makes me think when I come up to a jump, I've got too much to lose if I come off this and hurt myself.
I'm Gemma, I'm one of the orthopaedic doctors.
Oh, yeah.
The good news is that the CT scan shows that there are no breaks between here and your pelvis, probably just bruising and muscular pain. So I'm going to take this away from that ear, keep your head still, and I'm going to take the other one away from the other ear. There we go, well done. You relax back. He's all right, a bit stiff.
Craig's got to be kind of lightly. He's got a small air leak in his lung, very, very small air leak. Nothing needs to be done for it, which means we're just going to have to bring him under the orthopedic team just for observation, maybe overnight tomorrow. All right.
It's highly unlikely to get any worse, but just to make sure. Long way to fall is 30 feet.
Yeah.
So you're really lucky, though. Could have been a lot worse.
I think it's the best thing to have kids young. You can enjoy their life and you've set up a perfect family. Well, I hope perfect. But yeah, no, I wouldn't change it for the world.
I was trying not to worry about you earlier. I can't afford to worry about you at the moment.
I am sorry, I won't go. As soon as I'm tired, I'll stop, get off the bike.
Going to be a dad soon. Just not today, we hope.
Don't you go having that in now.
Actually, at least we're in the right place.
It is important to tell people how lucky they've been. Sometimes it won't be enough to make a huge impact, and then other times it can make people so much more appreciative of how quick life changes.
See you in a moment.
Especially when they have to watch their family and how concerned and how worried the family are.
Yep.
I think it'll change patients' perspective a lot.
See you later.
See you later, thank you.
See you later, guys.
I feel really lucky that she's still here with us. I feel lucky that there was no lasting damage, that she's such a happy, mischievous, stubborn little girl, but an absolute delight most of the time.
I always pray to God. I say, I don't want anything from you, God. All I want is peace of mind. When you have peace of mind, you have the world. That's what I want.
you.